Have you ever heard about cleft palate? Well, cleft palate is a form of birth defect that affects the formation of soft and hard palate, or the roof of the mouth. Cleft palate arises from a failure of fusion of the palatal shelves of the maxillary processes, or in other words, failure of fusion of the upper jaw bones during early embryonic development. It belongs to the larger group of orofacial clefts, which also includes other congenital abnormalities in the upper lip and teeth socket. Orofacial clefts are the most common form of craniofacial birth defect in humans, with an estimated total of 220,000 new cases each year worldwide. So, why do cleft palates happen? As we can all agree, the proper development of the face requires the precise coordination of a complex series of events. This includes cell growth, migration, differentiation, and apoptosis or planned cell death. Disturbances encountered at any stage of palate development can result in cleft palate. The disturbances can come from genetic factors such as mutations or environmental factors such as what the baby is exposed to during development. The genetic mechanisms contributing to the development of this abnormality are complex and multifactorial, and is generally associated with disruptions in certain cell signaling pathways, with one of the most well-characterized pathways being Sonic Hedgehog signaling. And yes, that is the name. We're not kidding. It is found that cleft palate formation is associated with the increase in SHH expression. How is this so? Well, this phenomenon can be explained by the expression of SHH in the fetus's oral side of the palate that characterizes boundaries between palatal shelves and signals the interaction between epithelial and mesenchymal cells. Further SHH expression induces epithelial cells lining the oral roof to translate transmembrane protein called smutant or SMO in short. SMO protein activates hedgehog SMO signaling pathways, which in turn activate the SOS-DC1 sequence. Specifically, SOS-DC1 is an inhibitor for both Wnt and BMP pathways, resulting in the downregulation of these signaling pathways. In BMP-induced bone formation, the formation of bones in the cleft palate is regulated by SOX9 and RUNX2 genes. Although the specific mechanism is still in research, it is believed BMP induces MSX1 signaling that is essential for palate development. Hence, inhibition of BMP pathway by SHH expression resulted in the alteration and/or deletion of previously mentioned genes and signaling pathways, stimulating the cleft palate formation process. Since right now we cannot prevent these signaling mishaps from happening, we can only surgically correct the malformations once the baby is born. It is important to perform this correction to achieve the functional and aesthetic well-being of the patient. The surgery can be performed once the baby is more than 10 weeks of age, usually at 12 weeks or 4 months old. After the surgery, the patients are fed using a syringe or a cup throughout recovery. Their arms are needed to be restricted to prevent accidental disruption to the surgery. Remember, the patients are mostly only 4-month-old babies. There will be monthly follow-up assessments post-surgery, or even more frequent for patients whose developments are delayed. Sadly, surgeries related to congenital deformities rarely are a straight path. Patients often would undergo other craniofacial and dental surgeries, as well as speech and hearing therapies to correct the rest of the malformation. Not to mention the psychological and social effects the patients would experience for the rest of their lives. In summary, we have known that cleft palate may be associated with hundreds of both genetic and epigenetic causes. We specifically learned about the best characterized pathway, which is the SHH pathway. However, we have not known everything. Other cell signaling pathways associated with cleft palate formation remains to be inadequately understood. As with other congenital disorders, research is still going on in unraveling these intricate mechanisms. Moreover, we are living in an era heading towards personalized medication. We hope that in the future, clinicians can make surgical and medical decisions based on a patient's genetic information. Whoa, what a heavy discussion! We hope you can follow along. Thank you for your attention and time.